the secret sauce is getting a balance of all the hormones. That includes testosterone, it includes estrogen, it includes progesterone. And just because you don't have a uterus doesn't mean you don't need progesterone. They can only patent the delivery system. Like the estradiol patch, the patch itself is patented, so that's not the drug. Because bioidentical hormones are naturally occurring. It'd be like patenting water. The protein thing, for instance, you have to factor in the activity level of the person. And if you're not active and you eat that much protein, well, it's going to turn to glucose because everything we eat eventually turns to glucose, and then you're going to store it as fat if you're not utilizing it. The other thing on the high protein diets is...
Welcome to Spotlight Sioux Falls, where culture meets commerce and the people behind our favorite places get the mic.
We're your hosts, Melissa Goodwin and Steve Schmidt, and we're sitting down with the makers, doers, and dreamers shaping the soul of our city.
From storefronts to side hustles, tattoos to tech startups, we are telling the stories that make Sioux Falls shine.
Because behind every business is a human story, and those stories, they're what make our community feel like home. This is Spotlight Sioux Falls. Welcome to Spotlight Sioux Falls. I'm Melissa Goodwin, one of the hosts of Spotlight, and today I am here with Jessica Morrell, owner of Radiant Health and Hormone Therapy. We're excited to be here. Thanks for being on the show.
Yeah, thanks for having me.
So Jessica you have a lot of letters behind your name. You're a CNP. You were an Air Force nurse for 7 years. Is that right?
That's true.
You are certified with the Institute of Functional Medicine.
Yes.
When you did your CNP, you did some research and it was all around hormone therapy. Is that right?
Yes. Hormones and menopause. Yep.
Hormones and menopause. So we're very excited because there's a lot of people who are very curious and there's a lot of information on the internet. And it's hard to sift out what's real and what might be exaggerated or what we should be doing. So I'm very excited to be sitting here with you today. So why don't you tell us a little bit about your background? We know that you're a nurse, but anything else would be helpful for the audience to know?
Sure. Went to nursing school at South Dakota State and then joined the Air Force and was an Air Force nurse and did a variety of things. And then got my master's from the University of Nebraska Medical Center. And that was in 2008. So I've been a nurse practitioner for a little while.
Yeah.
And I always had a desire to help women. And I did a women's health nurse practitioner program intentionally. And so my research was on hormone therapy and menopause. And the more I got into hormone therapy, the more discovered that you can't just look at hormones because hormones are impacted by so much more going on in the body.
Sure.
And so that's what led me to the Institute of Functional Medicine.
So you started actually in a large healthcare system, and now you have your own independent practice. Tell us a little bit about that journey and why you felt it was so important to serve women in this capacity.
So I did not leave the healthcare system intentionally, per se.
The healthcare system left you?
Yeah, COVID kind of did that.
Sure.
But has been a great move. And I didn't want to just quit working and quit doing this work because I feel that it's so important. So my husband said, well, I guess you better open a clinic then. So I said, okay. And that night we did an LLC.
Now I remember, so my mother used to go to the health system to do functional medicine and get her testing done. And I remember when that was going away, she was heartbroken because she's like, where am I going to go?
Yeah.
So tell us a little, what's different between functional medicine and traditional healthcare? Because it's very, sometimes we hear like alternative medicine or we hear other words and it's very hard to understand, like, what does this mean? What are we doing here?
Well, they're kind of synonyms, so it doesn't always mean that it's super different. But from I guess the biggest gist of it is functional medicine is really trying to get to the root cause.
Okay.
We're trying to look at not just physiologically what's happening, but what is happening in the environment that is causing those physiological changes.
Okay.
And that can be relationships, that can be exposures, stress, and kind of whittling through when did these changes happen and how do we go back and kind of redirect the body to go back to what it was doing before.
Yeah. And I would imagine it's hard to kind of tease all of that out. How do you guys go about here at Radiant figuring out, is it an environmental thing? Is it your hormones? Is it your stress? How do you understand what's really happening with your patients?
A very thorough history.
Okay.
A lot of questions. and just keep asking why, how, when. And we do some specialized testing. So maybe if somebody has had water damage in their house, maybe we're testing for mold.
Okay.
If they have had, all of a sudden they traveled and now they're having these GI issues or weird skin issues, maybe we'll do a GI test and look at the microbiome a little bit more deeply. If they've had a surgery or they've been on antibiotics, we might just treat them with some high-dose probiotics. We also look a lot at diet and have there been diet changes? What's the nutrition status like? That's a very large part of what we do.
Sure. So tell me, like, in terms of what you offer here, how does it differ from traditional medicine? I remember working in healthcare and innovation, and we would almost call it like sick care. You go to the hospital because you're sick and you need it fixed.
Yes.
What is it that you guys do differently?
We are dealing with people who are not sick, but they're not well. So they're in that
difference.
They're in that middle ground where they don't have a diagnosis because they don't have a disease.
Yeah.
But they do not feel in their prime. They've lost their zest. They just don't feel well. They're fatigued, but nobody can tell them what's wrong. And so I think one of the biggest differences that we have is time.
Okay.
We spend a lot of time with people because you can't get to those root causes. You can't get those questions answered if you don't have time. If you're trying to see somebody in less than 10 minutes, you're not going to understand what is going on with them.
Yeah. And I think one of the frustrating things, you go into a typical health system and you get like pummeled with like the same questions over and over again. It's like the list of stuff. And yeah, what do you have? 10 minutes? Is that what you typically have with a provider?
I mean,
10
on that.
minutes
Yeah.
usually is what you get. Okay. So tell us what the process might look like, because I'm in your target market. So what would you tell someone like me? What is the process for working with you? Do I come in once? Do I come in multiple times?
It'll be multiple times, but the first visit is the longest. It's an hour.
Okay.
And it's a thorough history, background, and kind of determining what are your goals, what's bothering you, and in my opinion, what do we need to look at? And so then we decide on testing, or we decide on some nutritional strategies, and implement that. And then if we've done testing, then you come back and we'll review that testing, and whatever imbalances were there, we'll address.
And you serve both men and women, right?
We do.
So I get served up all kinds of stuff around weighted vests, eat more protein. Like you're supposed to eat I've read stuff like you should eat a gram of protein for every pound of weight. Like that's a ton of protein.
It is.
So like, I don't know what that seems like a lot. I don't know. Maybe it's good or bad. I get served up stuff like everybody should be taking estrogen. Everybody should be taking stuff. What are we not being told when it comes to aging and aging well?
The protein thing, for instance, you have to factor in the activity level of the person. And if you're not active and you eat that much protein, well, it's going to turn to glucose because everything we eat eventually turns to glucose. And then you're going to store it as fat if you're not utilizing it. The other thing on the high protein diets is if somebody has a kidney problem, they can't have that much protein. That's going to be detrimental to their kidneys.
Sure.
So the only thing that everyone should do is drink water and breathe really well.
Yeah. Okay.
There is not one thing that is right for every person. Most people, yes, do need estrogen, and other hormones as well. And yes, once you get into this menopause transition, we need a higher protein diet. Is it 1 gram per pound of weight? Well, that depends on a lot of other factors.
Yeah, I would imagine if you don't eat that much protein normally and then you start eating 100 grams, like that's going to change your gut microbiome to a degree, right? Which affects everything else, right?
Right.
So tell us a little bit about, the roller coaster of hormones and how maybe stress and all those things affect that, because, you do have to come in for regular testing. That is one of the things you guys offer, right?
Yep. Because we want to know what we're treating, and we want to know that you are not getting too much, you're not getting too little, you're utilizing what we're giving you.
Yeah.
The roller coaster is usually between the transition, that perimenopausal period, and things that impact that are stress is huge. And it comes at a very stressful time in life because often at that, you're right around 50, late 40s, kids are leaving the house or you're having a job change. It just is a typical time for life changes.
You're buying a Corvette,
right.
Maybe finding a younger spouse. I'm just kidding. But
Yeah.
Sometimes.
Just seems to be the time in life where there's a lot going on. You're dealing with aging parents.
Sure.
So not only are hormones shifting, but then these stressors are all changing.
Right.
And cortisol, which is your stress hormone, really impacts hormone production and hormone metabolism and hormone utilization. Your gut microbiome impacts hormone metabolism, hormone utilization, hormone metabolism. So all those things that change, you can't just look at this hormone and expect everything else to fall in line.
Got it. So if you're sending in like the online services where you send in maybe a test, probably not getting a whole picture of your life, maybe, and they just prescribe you something, maybe
not. Depends on which testing they're doing. But without getting that stress piece under control and an understanding of what that stress piece is doing. So we'll measure cortisol levels.
Okay.
And
what do you do about it? What if you have high cortisol? What do you do?
Number one is some mindfulness.
Okay.
Some moderate exercise, because if you have high cortisol and you are a CrossFitter, you got to take a break, because exercise is good, but that high intensity exercise is very stressful to the body. And if you are at a high stress point emotionally, stress is stress. Cortisol is cortisol. So if you're raising that on both levels, you're really taxing your system. So there are times where moderate to light exercise is more appropriate for someone than really pushing it at the gym.
That's interesting, because I used to, and when I'd even know, like, there was a very stressful period of time where one of my kids was not doing well. A lot of work was tugging at me. And I would go on the Peloton. I would ride hard for like 60 minutes. And I felt like I needed it. But then I would get sick.
Yep.
Almost every time I would ride hard, I would get sick. And I'd be like trying to figure out like, what is going on?
You were burning off that cortisol that you'd been making, which made you feel good temporarily. But then you were taxing your immune system because you were on this cortisol roller coaster.
So what should I have been doing?
Probably some yoga.
Oh, that's the worst. I hate it.
Some gentle walking, some mindfulness. A little bit of the Peloton is fine to burn off that excess. Okay. But really, the only way to activate your parasympathetic nervous system, and that's the opposite of the fight or flight, is mindfulness, mindful breathing, meditation. We don't do that in our culture because we think it's a waste of time. We're not being productive. But it is so important to regulate the body systems and the internal body clocks and let that rest and repair happen.
And nobody wants to hear that. We just want a pill,
yes,
right?
We just want a pill.
So you help measure cortisol. You help people. Do you have mindfulness classes here, or how do you help people?
No, we don't. I have them start with 2 minutes a day of mindful breathing, and I'll just have them use the Calm app or listen to a YouTube video or whatever. And 2 minutes is very difficult for most people.
Yeah, I would be. It's difficult for me. I have a hard time to sit.
So if I can get them to do 2 minutes, that has shown to improve the parasympathetic nervous system.
That's amazing. So you guys do a lot of things here. You do obviously the functional medicine treatments for men and women. You also have some, what do you call, functional aesthetics. Is that right? Did I get that right?
Yeah, we kind of coined that term because
I like it. Trademark it.
It is not Botox.
Okay.
It's not filler. It is trying to help your body get back to where it was.
Okay.
So it's like facial exercise. We're involuntarily stimulating the facial muscles to rebuild that facial structure.
Okay.
So you're getting the lift in the face through exercising the muscles. So there's no downtime, there's no needles, there's no surgery. And then we're using ultrasound therapy to boost hyaluronic acid and collagen.
Oh, I like it. So is it like when you go to the chiropractor and they put the stim on you? Is it the same kind of thing?
It's similar, but much stronger.
But better.
Much stronger.
I like it. So we don't have to, I didn't even know there was an alternative to Botox.
Right.
So that's good to know.
Yes.
And I'll look just as good?
Yes. And you won't have any toxin in your system.
That's a bonus.
Yeah, we do use botulism toxin. We don't. Botulism toxin is used in chemical warfare, so it's appropriate for migraines. It does fix the wrinkles, but
but once you stop using it, they come back.
Yes.
And a lot of young people are doing it as preventative maintenance.
Yeah.
Which is We'll talk about that another time.
We'll talk about toxins together.
So when should somebody, like, how do I know when I should come and see? When is a time where I might think about coming to a functional medicine clinic?
Ideally, I would love for you to come when you feel amazing, so I could get a baseline on you. And so when you don't feel amazing, I know where the shift happened. But typically, we see people when they are kind of dismissed because they don't have a disease and the standard medical clinic doesn't know what to do with them in 15 minutes. And that is it's not because they have a bad doctor, and it's not necessarily the doctor's fault. They just don't have time.
Right.
And they just don't have time. So things that are happening in someone's life that would be a good fit. They're not sleeping. They're moody or irritable. They're gaining weight without really changing any of their lifestyle. They just feel fatigued and they just don't feel like themselves. I think that's probably one of the most common things people tell me is, I just don't feel like myself.
Mm-hmm. Yeah. So do you also treat younger than 18? Like what ages do you work with?
Teenagers usually. Like I'll see girls after they've started their menstrual cycles.
Okay. And what do they come in for?
Usually really bad PMS or really bad cycles, irregular cycles. Oftentimes they're anemic. That's one of the biggest things I find in the younger girls. And lack of energy. And
it's funny because you mentioned that, because there is a lot of, and not that the doctors are bad or that there's bad OBGYNs, but oftentimes younger girls get dismissed a lot too. If they say it's painful, they're like, that's just kind of how it is. Call me in a few years. And so they go years without being treated for endometriosis or anemia or whatever that might be.
And I think we're seeing PCOS and endometriosis earlier and earlier.
Yeah. Interesting. Okay. So one last thing I wanted to ask you about. So if I have, there was a lot of hubbub and hullabaloo and other words that I could make up here about what if you should take hormone therapy, over the last 20 years, and a lot has changed.
A lot has changed.
So we went from absolutely don't do it to now everyone's doing it. What if I'm in an age range where I feel like I've missed the boat? Like now I'm maybe 60 or 65, and I have gone through menopause, if you will. Is there just no help for me?
No, you have not missed the boat. So those receptors have been quiet. The hormone receptors in someone who's 65 have been quiet and non-activated for a long time, over 10 years, 15 years. And so we can start hormone therapy and reactivate those receptors, but we do it very slowly.
Okay.
And sometimes we do some detox support with it. Just
what is that?
So things that we want to clear out of the hormone receptors.
Okay.
Because over time they aren't awake, and so they'll get clogged with our environmental toxins. Or that's a very rudimental, that's probably a bad way to put it, but I guess that's the
clogged makes sense to me. I get it. That I can register.
But very low and very slow. Okay. But the benefit is it still will benefit their bone health.
Okay.
Cognition. The research on cognition and estrogen is quite amazing. Cardiovascular protection. Skin.
So estrogen helps your cognition and your heart. So does it prevent Alzheimer's or other dementia-related
I can't say that it prevents it, but in studies, this was with women at menopause time, not at 65. But they had two cohorts, and this cohort did not get estrogen. This cohort got estrogen, and these were their cognition levels.
Oh, wow.
Took these people off their estrogen, and that happened.
Okay. So you can't say it.
I wouldn't say it.
Clinicians
preventing,
are technical,
but it's not a bad idea. It's not a bad idea.
Yeah. Okay, that's good to know. So we're going to take a look at your functional aesthetics.
Yes.
You've got a lot of really interesting machines that are very high tech. It's very exciting. Anything else that you want people to know about you, the work that you and your team do, before we go take a look?
Our philosophy and our goal since we started has been to serve women. And we view it as our privilege to serve them. So this is a place where they are respected and getting people to just live at the best level that they can be at is our goal. So we're not trying to push as many people through as we can. We want to see the people and make as many people feel better as we can. But our goal is when we are with that person one-on-one, we are dedicated to them and we are listening to them and we are trying to make them be the best that they can be. And it's a partnership. It is, we're not deciding for them what they're going to do. It's an education back and forth. And they decide what steps they're going to take.
That's great. And I feel that. I definitely feel that when you walk through the door here. So let's take a look at the rest of the goodies that you have, and we'll talk with some more of your team.
Okay.
All right, Laura, it's great to meet you. Talk to us about, so I've heard a lot about M-Sculpt. Tell me what the M-Sculpt Neo machine does.
So, I mean, one of the main things that we do with this is strengthen. So we have the pelvic floor chair, right? So that was just because so many women struggled with incontinence that we see here. And so along with that kind of came this M-Sculpt Neo. And we just like to keep women moving really, really well, functioning well. And a huge part of that, I mean, is growing muscle and being nice and strong cores, strong pelvic floors. When you change those two things for a woman, their posture changes. We're helping decrease back pain. We're helping with more things than just changing somebody cosmetically.
Okay. So, and I do remember, so you have the ability to do some kind of not anti-Botox, but more like natural kinds of, firming, I guess, would you say, of your face? Tell us what this does for your face.
Right. So it's the exact same technology. So with the M-Sculpt Neo, you're going to get 22,000 muscle contractions per treatment. So we're able to strengthen the core. We're able to strengthen quads, calves, triceps, biceps. Like I said, pelvic floor with the macella. But then over there with the M-Face, we're able to strengthen the muscles in the face. So we're changing the contour of the muscles underneath the skin.
Okay. So it's actually like, it's almost like, sounds like stim for your face.
It is. So that one's 75,000 muscle contractions per treatment. And it just feels like a very gentle.
Doesn't hurt.
Tingling. No, it doesn't hurt at all. There's no needles. There's no downtime. It's a beautiful treatment just because people come in like on their lunch breaks. Okay. Several women have done that. So you come in, we hook you up, you sit there for 20 minutes and a lot of people fall asleep. Like it's very calming. It feels nice. I would say if anybody has any sort of complaints about it, it would be the cementum, just because it's a little bit more tender area, but really they tolerate that really well. And those are actually my very favorite results that we've had.
So instead of like maybe paralyzing a muscle so that you don't get wrinkles, you're actually strengthening the muscle, it sounds like. So that way you can hold your, maybe for lack of a better word, it sounds like holding your face up better. Right?
Exactly. So it's like going to the gym for your face.
Except you don't have to work out.
You don't. And you lay there, the machine does everything for you. It's typically decade dosing. So if you're 40 years old, we'd recommend 4 treatments. And then up to, 60 years old, 6 treatments there.
So there's the M-Face and then there's the M-Sculpt, and this is for the body, right? And so this is if you've got, muscles that you need to strengthen. And then tell me a little bit about this chair over here.
That chair is my very favorite part of my job, just because it's so life-changing for women. Okay. Stress, urge incontinence, sexual dysfunction. There's many different things we can treat women for with this chair. It's equivalent to 400 contractions, the Kegel-like contractions per minute. So it's a very good workout for the pelvic floor.
I'm going to sit on that chair.
You sure can.
Can I try sitting on this chair?
Absolutely.
Okay. I mean, I've had 3 kids. Like, it can't hurt me.
This chair should be in every single OBGYN clinic.
It sounds like
really,
it. Yeah, absolutely. So how often would I need to come and sit on this chair to make sure I'm in tip-top shape? For lack of a better word.
It's 2 times a week for 3 weeks. We need at least 2 days in between each treatment, and no more than 5 really to lapse. So there is a time frame that we want to get things done in. That's all the clinical studies are based off of 2 treatments a week for 3 weeks.
Yeah. And then how often do I have to do it?
So the pelvic floor is a muscle. If you're not using it, you're going to lose it. But we don't know how weak their pelvic floor is until after we've completed these treatments and we see how things respond. So essentially, when you come in for this treatment, we're tearing down the muscle fibers of the pelvic floor and then allowing them a couple of days to heal and then tearing them down again. That's how you build muscle.
Got it.
So then after that, I call all of my patients 30 days after they finish their last treatment with all of these machines. Your results are going to continue to develop over time.
Okay.
So you're going to see changes at 30 days, at 60 days, and 90 days is kind of the peak.
So functional aesthetics, you've got machines for your face, for your body, and for your pelvic floor.
Yeah.
Sounds like you've covered all of those different regions. So you could do all of them or none of them. Like what are some of the reasons people do come to, like most common? Like why do they come to use the M-Sculpt?
I would say I see a lot of people for abdomens. We've also got, there's another setting on this, of the M-Sculpt Neo, is the functional wellness setting. So that's going to focus more on if people have pain in their joints. So ankles, knees, tennis elbow. I'm treating one of my sons who's a pitcher right now for a shoulder issue he's got going on. And that's just going to bring blood flow back to the area. The contraction patterns and holds are just a little bit different. They're not as intense as a strengthening setting. So we're able, like I said, to create blood flow to the area and help heal, promote healing to whatever is going on. Ligament, tendon wise.
Let's sit on the chair. Let's see. Can I see what it's like? It's like I'm sitting on a cicada.
Well, it sounds that way. I don't know what it would feel like to sit on a cicada.
It probably feels like
maybe a little similar to that, I guess. Yeah. Okay.
Or maybe if I was sitting in a tree with a bunch of cicadas.
Sure. And a lot of cicadas. So I'm never going to look at a cicada the same, probably.
It's kind of a party.
Okay. So this should never be painful. So you would just let me know if you ever feel painful. So the first time that people come in, we just kind of work a little bit slower. Pelvic floor muscles have never been worked out like this before. So you just kind of go as the patient can tolerate. As you can see, I have complete control over how intense these contractions are.
Yeah.
But once you get rocking and rolling with it, it's 28 minutes. You remain fully clothed. A lot of women come in here, read a book.
If I was a rattlesnake, and I had my tail curled up underneath me, this is what I would.
I was like, where are you going with that?
I feel like this. And I was in danger.
Yeah.
You probably don't want to use any of this.
Well, whatever. I mean, I'll be very interested to see how this turns out. That's for darn sure.
I'm going to sell it for you. No, it doesn't hurt at all, though.
No.
It does feel like, it just feels like a tapping. It doesn't hurt.
So pretty soon you're going to feel a tapping sensation, and that tapping sensation is tapping out the lactic acid. So, when you go to the gym and you exercise, lactic acid builds up in your muscles. That causes you to be sore.
Okay.
With this, that feature releases all of the lactic acid, so there is no soreness. So there's no downtime. There's no pelvic floor rest, nothing like that. So you literally walk in, you're treated, and you can leave and go about your day.
Wow. Okay. So for what is the degree of severity of pelvic floor issues that I would have, that I would come to see you, or maybe I try this first before I go see a doctor?
That's the beautiful thing about us treating you here with this machine, is just because I've got 3 nurse practitioners that I can go talk to about anything.
Sure.
They're the ones sending a lot of patients this way as well. We've seen women with pelvic floor prolapse.
Sure.
There's a lot of rectal issues too, rectal leaking. There's the men that have had prostatectomies that then.
Yeah, I was going to ask about that. So a man who has had issues with prostate may want to come here for this as well, right?
Oh yeah. We've treated quite a few men with that.
Okay.
So yep.
Now it's tapping. Now it's knocking on the door.
Yeah. Yes.
No one's home. Just kidding.
Well, no, you're going to feel different sensations throughout this entire treatment. It's basically a HIIT workout for your pelvic floor. So those muscles are going to be worked out several different ways throughout this treatment. So you're going to feel a lot of different sensations.
And so how do I know if my pelvic floor, I mean, obviously incontinence is a thing, but I mean, most of us have had, many women have had children, more than one. So, and it might not even, you might even have issues early on, but as you get older, things may become more and more severe. So, what might be a trigger that I need to come in and check this chair out?
I mean, if you're doing jumping jacks and you're leaking, or laughing and you leak, or you have urgency, like you have to go to the bathroom right now.
Yeah.
Running to the bathroom. Those kind of things. Then it's time. I mean, and actually, if you can come in before the symptoms get really bad, then you really can tighten things up, and then you don't have to go through the humiliation of peeing your pants. I mean,
Right.
it's so normalized. I think people just laugh about it and think it's a funny thing, and it's not funny. Like there's so many people that it affects their lives in big ways. I've had women not go on girl trips because they can't ride in a car for more than an hour without having to stop to pee. Like so I had one woman that came in here and her life was changed by that. She got to go on a trip. And so that was like super cool.
Yeah, that's awesome. All right, Laura. So if I'm not feeling good, or if I maybe want to try an alternative to the needles or fillers, so I should call you, right?
Absolutely.
Okay. Any other reasons why someone might want to come into Radiant?
I think as a 44-year-old woman, I feel like we need to start looking at hormones sooner. I spent so many years of my life not feeling good and gross, and raising kids, you're in the thick of it. And usually moms are the last person
to take care
of themselves.
Yeah.
And so I couldn't encourage anybody more to come in and at least have your hormones looked at. Come in and chat with one of our providers. All three of them are wonderful. And they'll get you going in a really good direction, whether it might not even be hormones.
Maybe just get your baseline.
Yeah,
right?
Get a baseline, know what's happening, know what you feel like when your hormones are good.
Yeah.
So it's never too early or too late. I would say that too. I see a lot of women here that come over here to do this kind of stuff in their 70s that are just living their best lives. So it's not too early, never too late.
So if you want to connect with the folks at Radiant Health and Hormone Therapy, click on the links below. We'll make sure to link to that in the full episode. Make sure to subscribe to Spotlight Sioux Falls. And I'm excited to get my face work done here. So let's get going.
Let's do it.
Thanks.
Thanks for listening to Spotlight Sioux Falls.
These are the stories and the businesses that shape our city. If you heard something today that made you smile, made you think, or maybe reminded you of someone you know in your neighborhood, please share it.
That's how we support local. That's how we grow. And if you know a business owner we should feature, or you want to tell your story, reach out.
Until next time, we're Steve and Melissa, and this is Spotlight Sioux Falls, where local stories get the stage they deserve.